if we think in the cost to other diseases outside COVID, I think the pandemic was tremendous because I think there was no disease. I think we cannot measure yet the real impact it had because it impacted everything. Hospitals collapsed mean that people died of heart attacks, of strokes. Severe chronic disease were unattended because they need hospital support, and any illness was unattended. The lockout produced itself other diseases, mental health, the main, from anxiety, depression to suicides. We are all conscious that we have a serious problem of mental health now. Then we have the global lockout with problems of supply. Dr. Alonso mentioned them. Vaccinations, 2020, during the year 2020, at least 23 million children didn't receive the usual vaccines for any diseases that they used to receive. TB, tuberculosis, more than 1 million people didn't receive treatment. And today is the World Day of Tuberculosis. So we all are reading these numbers everywhere. So the global lockout was another cause. The self-economy, because there was no money for fund all the diseases, because COVID needed money and the economy went down. So it was, and moreover, this was uneven, the distribution of the impact. So inequity increased a lot. The numbers of poverty are tremendous. So the situation we have is really very deep crisis. I think we have to approach it. So some hope, yes. Science, technology, industry were the surprise, the big impact, because we have so many different vaccines of different technologies approved in extraordinary times. We have so many diagnoses also of different technologies. So I think that industry, science first, and all this was perfect. And I think that digital technologies were also something very important, from virtual communication that helped so much in the lockout, to data, for instance, or apps, different apps. Data was also, it was incredible for all of us that we always need more data to see that all the data in the same way were everywhere, every day. Then we have to see what was the use of the data, what was the management of the information, but the data was there, and that was very, very important. So, and I think also, as Dr. Alonso said, that the awareness of public health was very important. Infectious diseases were out of the agenda before the pandemic. We only had chronic diseases, aging, there were no more infections. So I think that the impact of a virus in all the countries as it was changed the agenda completely. So we hope this will help in the future. So that will be part of the lessons. I agree that lessons are for the leaderships. Health is not a cost, it's an investment. The cost of non-prevention is incredible. So I think Pedro said it so clearly. It's now we need to do this, but we are not sure that it will be done. We hope it will be, will work. We have to think again, because we had many lessons, but we are experts in rethinking. We thought that we had to rethink before COVID. So now more than ever, we think that we need to rethink. We don't want to go back to where we were. Even the high income countries were not prepared to reply to the pandemic. There was no preparedness at all. So I think that the concept of One Health that is growing, in which we believe for always, it's important, because I think there are things of management. You don't need a lot of money to think in One Health. That means animal health, human health, environment. It's coordination. I think we need coordination, we need partnership. I think cooperation was something also that we saw during the pandemic. So I hope we'll consolidate that. And I agree that we don't see any more about COVID, but I think that public health should be in the mind of all the authorities, and we'll work for that as always.